Okay, so we have here the differential count. So normal differential count we have here for the adult patient, that's 70, 30, 70 lymphocyte, and 30 monocyte. But in the case of your children, the ratio is reversed, where you have your high concentration or high number of your monocyte compared to your lymphocyte. That's become 30 to 70. So we have here the normal cells here found, or the cell found here, the CSF. So first we have here the neutrophil. The neutrophil are usually increases in bacterial meningitis. Could also see an increase in the early stages of your parasitic, fungal, viral, or tubercular meningitis. Sometimes we could also see here neutrophil related to your hemorrhage, recent or traumatic top injection of your radiographic dye. And sometimes you could see here neutrophil having the pycnotic nuclei, and that's would resemble here the nucleated RBC. Only that your neutrophil is multinucleated, so your NRBC hindi siya ganun kadami ang kanyang nucleus. Okay, then we have here the lymphocyte and the monocyte. So basically increases during the viral meningitis or even related to your HIV. So sometimes you could see also here reactive lymphocytes. So reactive lymphocytes are those having a dark cytoplasm and would have here a clump nuclear chromatin. So sometimes you could see here increase of UBC count with the presence of both your normal and reactive lymphocytes associated with your degenerative disorders. Example for that, we have our multiple sclerosis. Then we have here the eosinophil. So that's related to your parasitic infection, fungal infection, specifically your coccidioides immitis. It also be related to your administration of your medications and even their chance to your CNS. Okay, then next we have here the macrophages. So macrophages basically its main function to remove the debris or the RBC within the CNS. So basically macrophages could be found here in the in the previous na traumatic top or hemorrhage. So once your RBC here has been degraded, degenerated, it could be converted to your iron-containing granules, your blue-black granules, they call it once your hemosiderin granules. And further, they could also be converted here to your yellow hematoidin crystals. Okay, the next one, we have here your non-pathologically significant cells could be found here in your CNS. Again, the cells here could be obtained following your following the surgical procedure here related to your CNS, like your neurosurgery or pneumoencephalography. So first we have here the choroidal cells, which try to line here your choroid plexus, is singular clusters with the absent of your nucleoli and very prominent nucleus. Next, we have here the ependymosis, found the ventricles and the neural canal, could be found here in clusters. And now you can see already the presence of the nucleoli. The third one, we have the spindle-shaped cells, which try to be found here in the arachnoid space, and that one could be associated with your systemic malignancies. Okay, then we have also other cells here that could be found in the CNS. So we have a clinically significant cells of your hematologic origin. So they are basically arising from your bone marrow. These are related to your leukemia, lymphoma. So these are mga young cells which in the form of your myeloblasts. We have also here your monoblasts. Another one, we have here clinically significant cells which are non-hematological origin. So they are not originating from your bone marrow, but rather they are produced here because of your number one, their cancer cells. Cancer cells here, metastatic carcinoma related to cancer of your breast, lungs, kidney, and we have also gastrointestinal tract. Another one, we have here related to your CNS tumors. And the cell may be in the form of your astrocytoma, retinoblastoma, and we have also your medulloblastoma. Identification of your abnormal cells would have your characteristics of, we have the fusion of the cytoplasm of your cells here, nag-group sila. Then we have also here your nuclear irregularities and a very prominent nuclei that would identify that one is abnormal or pathologic na cell. Okay, now we go to the chemistry test. So basically, the substances which are present in the CSF will not be the same composition present in your plasma because again of the active filtration because of your blood-brain barrier. Okay, so first we have here the protein. Normal values of protein would be 15 to 45 mg per dl. So, normally present na protein, highest concentration would be in the form of your albumin, followed by your pre-albumin. Alpha globulin protein is in the form of your haptoglobin and your ceruloplasmin. And the beta globulin here would be your transferrin. Then we have also here the presence of your tau protein. Tau protein here is a carbohydrate deficient net transferrin. This is very specific for the CSF. So like if you don't know, if you are in doubt if the specimen is CSF or not, then you need to test for this one. Pag present ito, meaning to say this one is your CSF. Then for your immunoglobulin, that's in the form of your antibody, IgG, at saka IgA lang ang present natin. And basically, your CSF would not have here the presence of your fibrinogen, your IgG antibody, and we have your beta lipoprotein. Okay, for the clinical significance, decreased protein associated with the leakage of your CSF na fluid. And then we have also here increased na protein, your CSF related here to your disruption in your blood-brain barrier in the case of your of some of your damage. We have also increased immunoglobulin production within the CNS in the case of your multiple sclerosis, and we have also decreased clearance of the protein. Okay, next we have here your detection of the oligoclonal band. So the oligoclonal band here primarily during electrophoresis is try to migrate within your gamma region, signifying that one is actually an immunoglobulin. So we have here identification of your oligoclonal band found here in the CSF only, wala sa blood ni patient that would relate to conditions like multiple sclerosis. We have also here your encephalitis, neurosyphilis, and Guillain-Barré syndrome. You could identify that one is caused here by multiple sclerosis or this one. It's because here in the remission stage, mean to say recovery stage, even the recovery stage na ang patient natin, the oligoclonal band is still present. Andun pa rin siya, that's multiple sclerosis. Pero pag nawala siya, ang oligoclonal band sa CSF, naging negative siya on the remission stage, so ito yung mga conditions natin. Another one, we have your oligoclonal band here present in both in the CSF and your serum sample or in your blood here signifies conditions like your lymphoma, leukemia, HIV, viral infections, and many others. You could perform the electrophoresis. You could have your agarose gel followed here by Comasi, brilliant blue staining reaction here, and you could also have your immunofixation or isoelectric focusing followed by the silver stain to visualize your electrophoretogram. Okay, the next one, we have here your MBP, your myelin basic protein. So myelin basic proteins, protein could be found in our myelin sheath. So myelin sheath here is actually the one trying to protect your axon of your neurons. Okay, so increased myelin basic protein signify here the destruction of your myelin sheath, and that might be related to your multiple sclerosis. Okay, the next one, we have here your CSF glucose. Okay, the normal CSF glucose is 60 to 70% of your blood glucose. Mean to say, you need to measure the blood glucose level of the patient and then try to compare the glucose level of that. Dapat 60 to 70%. Like, if the blood glucose 100 mg per dl, dapat ang CSF glucose mo is nasa 60 mg per dl to 70 mg per dl. Okay, when you're collecting, analyzing your CSF glucose, then you need the patient should be in the fasting state for approximately 2 hours. Then you need to have here the blood specimen, CSF specimen for the glucose determination. Okay, we have here the significance. Increased glucose level here associated with the overflow of your blood glucose in case of your diabetes mellitus. Decrease naman because of the alteration in the transport of the glucose across your blood-brain barrier for continued use of the microorganisms. Then we have here for the differentiation between your different meningitis. So we have decreased blood glucose, decreased CSF glucose, increased WBC count. You have also increased neutrophil that signify bacterial meningitis. Decreased CSF blood, decreased CSF glucose, increased WBC count, increased lymphocyte. That's your tubercular meningitis. But pero pag normal glucose mo, increased WBC counts, which are more of the lymphocyte, that's your viral meningitis. Okay, the next one we have here the CSF lactate. So lactate is actually the product of your okay, that's your glucose converted to your lactate, because normally your glucose converted to your pyruvic acid. But in case wherein you don't have the oxygen, in the case of your hypoxia, so decreased oxygen supply to your brain, where your glucose converted to your lactic acid. So that's why you have increased lactic acid. Okay, we have here the clinical significance. More than 35 mg per dl lactate concentration would signify bacterial meningitis. Less than 25 is your viral. And level between 25-35 signify tubercular or fungal meningitis. Next one, we have the CSF glutamine. Glutamine is being produced here from your ammonia plus alpha-ketoglutarate. So, it just represents here the level of your ammonia in your body. So, increased ammonia level signifies also increased glutamate. Glutamine. Glutamine or glutamate. Okay, so ammonia is a toxic substance in our body. So, basically, the conversion of this occur in the liver. So, any problem in the liver, you could not metabolize your ammonia. And therefore, it try to accumulate, so therefore try to increase your glutamate level as well. The normal values of that 8 to 18 mg per dl, but in the case of more than 35 mg per dl, sobrang taas na yan. Remember that, again, your ammonia is toxic substance and therefore should be eliminated in our body. So sobrang dami ng ammonia, then the patient try to undergo here or magiging comatose ang patient natin. And then also, increased level of your glutamate ammonia is related to your liver problem because again, metabolism will not occur in the liver. So if you have problem in the liver, you could not metabolize and therefore try to accumulate in your plasma or even your CSF. Raynaud syndrome here very common among young children, and that's also characterized by liver problem. Okay, the next one, we have here your microbiome test here. So for the microbiome, you need to concentrate your specimen by centrifugation at 1,500 G-force for 15 minutes. So what we are doing here for the grams, for the microbiome test, we need to culture that one, culture and sensitivity, plus your gram stain, plus your acid fast stain. Okay, we have the causative agent of your meningitis, gram positive, we have strep agalactase, strep pneumoniae, Listeria monocytogenes. For the gram negative, we have Haemophilus influenzae, Listeria meningitis, and we have your Escherichia coli. For the fungal meningitis, you could have your Cryptococcus neoformans. So you could have your India ink test for that, for the identification of your capsule. Okay, then another one, we have also here your gram stain. You would have here a characteristic starburst appearance. Serological test, you could perform here the latex agglutination test, but you need to be very careful because the rheumatoid factor might interfere with the test. It will give a false positive result. On the other hand, in the case of your neurosyphilis, so for your syphilis infection, so pag neurosyphilis, we're talking about the tertiary stage ng syphilis natin or the late stage. So for identification of that, you could have here your VDRL. Only that ang VDRL, I think pag tertiary stage, it will already give a negative result. But your VDRL is a test for your syphilis. This is non-treponemal antibody test. Specifically, so mas specific ito for your tertiary stage, your fluorescent treponemal antibody absorption test. Okay, so that's the end of your CSF discussion. Okay, thank you.